My mom is First Nations. She grew up in a residential school and living on a reserve, and just knowing my family, seeing the world that they grew up in and the world that they live in, and recognizing that the challenges are right there in their communities in terms of access to healthcare, in terms of the resources they have on their reserve, in terms of how much room we have to go to improve things. Being a physician in northern British Columbia, I see a lot of patients coming from rural and remote areas. Particularly seeing a lot of women with breast concerns and unfortunately also breast cancer. It's not unusual for a woman to have an abnormal screening mammogram. Her family doctor will then see her, explain this, and refer her on to the general surgeon. So then when I see her, she has to travel in sometimes even further than where that mammogram was located. And she comes in to see me, then ultimately she needs a biopsy. And that can't be done just on a whim. So I order it, and then she often has to come back. If it is cancer, that means multiple more trips for consultations and for the surgery, and ultimately to potentially have radiation therapy or chemotherapy. And so this is really significant for a woman. Even if you just had to walk across the street, this is a scary process. And these are multiple trips, hundreds of kilometers sometimes. If they get discharged home in Prince George or in an urban center, there's lots of resources out for them. But if they get discharged home to a remote, rural community with not even a healthcare clinic, that's a whole different story. And there's too many people, I think, that are lost in the system. You can tell a lot of stories. You can bring tears to anybody's eyes if they understood what was happening on our soil. But in order to change policy, you need to actually have the numbers. And so the Northern Breast Cancer Database is an effort to collect data from years past from women who have had breast cancer in the Northern Health Authority. So we could ask, what stage were they being diagnosed? How long was it taking for them to get their treatment? What were their long-term outcomes? All these questions that I think in the North we have a right to know. You show numbers that don't lie, that can't go away, that when you leave the room, the story is left there, but the numbers can be put on a piece of paper and can't be ignored. And you start to realize that in the end, if you're just looking at the mammogram, it looks the same. If you're looking at where that mammogram came from, not just the person, but the family and the community and the resources available on each of those levels, you can see that there's significant differences and disparities. And I think we need to address that so that when that person, whose mammogram it is, goes to the operating room, they have the same chances and the same likelihood that they're going to beat this disease and they're going to get through it, and it's going to be an experience that is respectful and culturally safe.